The CDC has given the green light for 12 to 15-year-olds to get the Pfizer COVID-19 booster shot. The approval comes after the CDC's decision to shorten the time needed between a second and third dose of the vaccine from 6 to 5 months. The rapid spread of the Omicron variant is once again affecting the cruise line industry. At least two major cruise lines, Norwegian and Royal Caribbean, have canceled trips because of crew members testing positive for COVID-19. And Chicago public schools are closed for a second day because district officials and the teachers union failed to agree on COVID safety measures. The teachers union voted to stop in-person classes because of the surge of COVID cases, but the mayor does not agree. For more on this, I want to bring in Dr. William Schaffner. He is a professor of preventive medicine at Vanderbilt University Medical Center. He is also a member of the CDC's Advisory Committee on Immunization Practices. Dr. Schaffner, thanks so much for being here.
Good to be with you, Meg.
So first of all, why did the CDC recently change the time period between the second dose and third from 6 months to 5? Was this purely because of Omicron, or do we need that booster to be fully vaccinated?
Well, we certainly do need the booster, and we'd like to get those boosters in just as quickly as possible. And the scientific data accumulated such that we don't have to wait for 6 months. We can still get the same effect by getting that booster after 5 months. So that makes a lot more people eligible for the boosters sooner, and that's a good thing.
So we know the boosters for immunocompromised children, 5 and older, have been authorized. Why isn't that the case for everyone in that age group just yet?
Well, we need more data for everyone, but we know that immunocompromised children don't respond very well to the initial series. Their immune systems are compromised. And therefore, with adults and now with children, we give them an extra dose in the hopes that their immune systems will see the vaccine a third time and finally respond. But it's a difficult matter. Every immune compromised child won't respond, but we want to give every immune compromised child the chance to respond.
Dr. Schaffner, for people who have young children, can they expect to see a COVID vaccine for kids under 5 years old anytime soon?
We'll have to wait for the data. We need more information. We want, when we make that recommendation, to be absolutely sure that it's not only effective, but safe. We're gathering those data as we speak. It will take a little time yet.
Now, we mentioned earlier, Chicago public schools are closed for a second day. The science says if mitigation measures are taken with masks, social distancing, vaccine, kids are safe in schools. The teachers union is fighting this. Are there any of their reasons, are they valid for not wanting to return?
Well, I'm certainly an advocate of opening up schools if you do everything right. You know, by now, every adult associated with schools should be vaccinated, absolutely everyone. And we should strive to get every child older than age 5 vaccinated. And if we do that, plus hand hygiene, plus masking, some social distancing, schools can do what they're supposed to do for the benefit of children at very low risk.
And we've heard time and time again that schools are the safest place for kids. If you're vaccinated and boosted, you're protected against major illness. Yesterday, we saw French President Macron say he's going to make life more difficult for the unvaccinated in his country. It's been almost 2 years of this virus in the U.S. Everybody is sick of it. Is it fair to ask people who are fully vaccinated to continue living their life a certain way because of those who refuse to get vaccinated?
Well, we all have to work together on this. And clearly, we're trying to persuade our reluctant friends and neighbors, and some of them are kind of stubborn, to come in and be vaccinated. If they did that, our entire communities could move forward. And I would anticipate by the end of this month, beginning of next month, if we really got together, then we could get ahead of this virus for the first time.
I think last summer, we were so tired after the Delta surge, and then we thought, okay, maybe it's over, and then the Omicron surge came. How many more variants of this can we expect in the future?
Well, Meg, that's why it's very important that we have a global perspective. Every one of those variants appeared somewhere else in the world and then came here on a plane. Now, in order for us to control COVID globally, we're going to have to do our work at home, but then extend our activities around the world. There are humanitarian reasons for doing this for sure, but there are also reasons of self interest. While this virus spreads elsewhere in the world, yet another variant could crop up. And by vaccinating the rest of the world as we're vaccinating ourselves, that's the way to reduce that chance of happening.
All right, Dr. William Schaffner, thank you so much.
Thank you, Mary.